In terms of the respiratory system, I mean, we might have antenatal concerns which were highlighted, and congenital anomalies may be there. But apart from that, it's mainly the well-being of the baby that is looked at. One of the main problems that may be missed out is guanal atresia, which is unilateral. Bilateral guanal atresia presents with the baby getting dusky when baby is quiet, but when the baby cries, the baby's color improves. And obviously, unilateral may be presenting later on because it's just the baby can cope with unilateral obstruction, but it may come with the distress or noisy breathing and so on. And examination of the abdomen mainly for organomegaly, and you may have antenatal scan concerns like renal, hydronephrosis and so on, which we have protocols to monitor. The genital examination is very important, and in a male, it's very important not to miss undescended testis. I mean, this is one of the areas which come back with complaints where the doctor misses it, then a grandmother picks it up at home, and then they come back. The pathway of testicular descent. So it starts in the perinephric area, and then it descends down. The gubernaculum testis brings it down and through the inguinal canal. In a premature baby, it's already in this path of descent. So when a baby is born at 33, 34 weeks, often you get it in the inguinal canal, and by the time they reach term, it descends down. If it is twin pregnancies, you may have disparity between the twins in the rate of descent as well. So you may have to reassure the parents that only monitoring is needed. If the undescended testis is bilateral and the phallus is small, then you have to look at the virilization pathway, because a bilateral undescended testis and abnormal phallus could indicate a virilized female baby, which should point to more serious concerns like congenital adrenal hyperplasia. So this is the pathway between the female genitals and the male genitals, how the testosterone related aspects change the approach, and you get anomalies in the way like you may get a significant hypospadias, for example, which is part of the under-virilization of the male problem. Micropenis is another genital problem which can point to other problems like hypopituitarism. The stretched penis length should be measured carefully, and if it is less than 2.5 centimeter, it's an area of concern, especially if the baby has other features like poor feeding or hypoglycemia or persistent jaundice. You have to work up in to rule out endocrine problems. Hypopituitarism can present mainly with this, and we have to refer to the endocrinologist.